the Western Sahrawi. On to other news now. The Health and Human Services Secretary in the United States says the country's Food and Drug Administration will grant Emergency Use Authorization, or the EUA, for the Pfizer-BioNTech vaccine, and that the general public could start receiving their first immunizations as early as Monday next week. This follows a decision by an independent advisory panel late on Thursday to approve the vaccine's use that will see healthcare workers and nursing home residents and staff at the front of the line. The panel's decision was not unanimous, with 17 votes in favour of the approval, 4 against and 1 abstention. Our US correspondent Sherwin Bryce-Pease joins us now for more from New York. Sherwin, a very good evening to you. Thanks for joining us. Welcome to The Full View.
Hi, Simpiwe. Good to be with you.
Now, so to start, Sherwin, perhaps clarify for us, if you can, where the approval of these vaccines stands, because we saw the process scale and the important hurdle last night, but we're not quite there yet in terms of the FDA officially giving the green light, isn't it?
Absolutely right. Yeah, we're on the brink, on the cusp, if you will, of FDA approval. Essentially, this was an advisory panel to the Food and Drug Administration that met for 8 hours yesterday, eventually voting to advance the process one step closer to what we expect will happen this weekend when the FDA, the Food and Drug Administration, gives emergency use authorization for the Pfizer-BioNTech vaccine. Of course, this has been a long-standing process, Simpiwe, and once we then have that approval, another long process then begins, because initial doses will be limited to around 25 million doses from the Pfizer vaccine, which means only a small fraction of the 330 Americans in this country will have access to that vaccine once it gets the green light. In fact, Mark Mulligan, who's the director of the Langone Health Vaccine Center here in New York, explained how this process is going to develop over the next coming weeks and months. Let's watch what he had to say.
It'll be more like a dimmer switch, where we'll gradually turn up the dial 10%, 20%, 30%, as we have more vaccine supply, which will be quite limited at first, as additional vaccines like Moderna and then hopefully others are also granted EUA for use here in the U.S. So I'd like to put that image in everyone's head, not an on-off switch where all of a sudden, we're going to see a dramatic change, but the idea that over time, as we vaccinate more and more people, we will ultimately, maybe by mid-year next year, 2021, achieve herd immunity, perhaps 75% of people vaccinated, to shut down and end the pandemic, hopefully in 2021.
So, Simpiwe, as we've been hearing for months from the outgoing President of the United States, Donald Trump, that we were turning the corner in terms of the COVID-19 pandemic because of the closeness we were to getting to this point. This is a very long corner and a very long bend, because once we get this emergency approval, we are just at the beginning of vaccinating 330 million Americans in this country, which is going to take some time.
And do explain for us why some of the scientists on that advisory panel, Sherwin, voted no, or some even abstained.
Yeah, so 17 in favour, 4 voted no and 1 abstention. And the question they were voting on is a very specific question, Simpiwe. It says, based on the totality of scientific evidence available, do the benefits of the Pfizer-BioNTech COVID-19 vaccine outweigh its risks for use in individuals 16 years of age and older? And 2 of those no votes have gone on the record to explain that it is because of the 16-year-old age consideration that they had an issue with. So if, for example, the question was about 18 years and older, which is the legal age, you can vote when you're 18 in this country, essentially that is regarded as a legal threshold in terms of what you can decide as an individual. They felt that 16 and 17-year-olds would not therefore have that legal right to opt into, to decide for themselves whether they would want to take a vaccine or not, and that decision would have to then be made for them. So essentially they said they would have approved the vaccine were it to have started from the 18-year category and older. Some of the other questions to come up is the fact that clinical trials in terms of the Pfizer vaccine has not taken into account people younger than 16 years old. So from 0 to 15, what would clinical trials, if those were to be undertaken, as we understand Pfizer will be doing in the months ahead, what will the results of that sort of age group show us? And another question is the allergic reactions that have been reported from some of the participants in the United Kingdom when they approved this vaccine. Concerns about allergic reactions and what that actually means in terms of getting buy-in from the broader public here. If you have an allergic reaction or you're prone to have an allergic reaction, the advice right now is to be cautious and not to take the vaccine. Simpiwe.
I suppose the issue of the allergic reaction is very important there, Sherwin. But then the focus has largely been on the efficacy and the safety of these vaccinations, as so as to meet the scientific scrutiny necessary to approve their use. But once that is done, this becomes an exercise in logistics, an exercise about storage and so on, to ensure that they reach the length and the breadth of the country.
Absolutely right. So, your United States Post Office is very much part of the conversation. DHL and companies like FedEx, for example, will be part of, transporting this vaccine. But in addition to that, the big question is, do various counties and cities and localities have the storage capacity? The Pfizer vaccine, for example, has to be stored at a temperature of minus 70 degrees Celsius. Moderna, which we understand will be analyzed by that very advisory panel that has just given the go-ahead for Pfizer. That next week, that vaccine will have to be stored at minus 20 degrees Celsius. Some of the other vaccines, like AstraZeneca, for example, we understand once that's approved, will have to be stored at sort of general refrigerating temperatures. Susan Mashney is the chief pharmacy officer at New York City's Mount Sinai Health System, one of the largest health systems in the city. Simpiwe, she explains some of the storage facilities that they've equipped their hospitals with. Let's watch.
That is currently within range. So the most important thing is, we only have about 90 seconds to unload the box and get it in the freeze. And then once you've got it in there, it's going to be 20 minutes before you can get back in. So you have to be pretty careful and thoughtful about it. And just a reminder that when we defrost, it takes about 3 hours to defrost. It's a frozen suspension. So we're going to defrost it, and then once we reconstitute it, we have about 6 hours to use it. And this whole freezer can hold like a couple 100,000 doses. We expect we'll only probably get in the thousands initially, and maybe 5,000 doses at any given time at one site. So it should be really absolutely sufficient. It's not going to be like filling your freezer at home.
So some of the words we're now hearing in terms of vaccines that you don't often hear, Simpiwe, defrost and reconstitute, part of the process that must be factored into how these vaccines are going to be administered.
And around 6,000 people in the United States died in the last 48 hours alone due to COVID-19, and over 3,000 people died on Wednesday, and over 2,900 people have died on Thursday. And those numbers are expected to grow, and all indications are that the worst is still yet to come.
Yeah, over 6,000 people have died in the United States over just the last 48 hours. We are reaching new case levels of over 1 million within a week, if not less, over 200,000 new infections every day and rising. And the CDC, essentially the Centers for Disease Control, projecting that up to 362,000 people in the United States could die by January 2nd, Simpiwe. We are now at over 290,000. That's 70,000 more people in just the 3 weeks that take us to January 2nd. Robert Redfield, the director of the CDC, was in conversation at the Council on Foreign Relations yesterday. This is how he explained it.
We are in the time frame now that probably for the next 60 to 90 days, we're going to have more deaths per day than we had in 9/11 or we had at Pearl Harbor. I mean, this is really, as I said, this is going to be a real unfortunate loss of life, as all that we've had so far. And the reality is the vaccine approval this week's not going to really impact that, I think, to any degree for the next 60 days. And this is why we have to really do everything we can.
So the vaccine is not going to have any impact in the short term, Simpiwe, and the big concern is that we have yet to see the impacts of travel. Millions of people in this country travelled for the Thanksgiving break at the end of November. We have not seen the surge from that travel, and of course we are about to crash into Christmas when a lot of people in this country are planning to go back to their families to spend Christmas at home, and of course transmitting and transferring the virus around the country. So public health officials, the President-elect Biden talking about how we are in for a dark winter here in the United States.
And finally, Sherwin, before I let you go, now the Time magazine today announced their Person of the Year honor to President-elect Joe Biden and the Vice President-elect Kamala Harris. Briefly tell us why they went with that choice.
Well, from the 16-year-old Greta Thunberg, who was the Person of the Year last year, to the 78-year-old Joe Biden and his Vice President-elect Kamala Harris, I'll just read you what Time magazine said in terms of this honor. If Donald Trump was a force for disruption and division over the past 4 years, Biden and Harris show where the nation is heading. A blend of ethnicities, lived experiences and worldviews that must find a way forward together if the American experiment is to survive. For changing the American story, for showing that the forces of empathy are greater than the furies of division, for sharing a vision of healing in a grieving world, Joe Biden and Kamala Harris are Time's 2020 Person of the Year. I can tell you they have both tweeted about this. The President-elect Biden said he was honored, along with Kamala Harris, and grateful to be on the list of among so many extraordinary folks, from frontline workers to racial justice organizations. Americans met this year with strength, fortitude, and an unflinching belief in a brighter tomorrow. Of course, the other groups that were in the running for this were frontline health workers that Time acknowledged as the guardians of the year, and of course the movement for racial justice in the United States and Peru. But Time at the end settling on Joe Biden and Kamala Harris.
Sherwin, great chatting to you. Thank you so much for your update. We appreciate your time. All right, that was SABC News correspondent coming to us live from New York, Sherwin Bryce-Pease.